Hello everyone, welcome back to Pharma again. In this video, we will cover next drugs that are paracetamol and ibuprofen. In the last video, we have already covered aspirin as well as introduction to NSAIDs. Now we will see paracetamol first. So paracetamol comes under para-amino phenol derivatives. So paracetamol is also called as acetaminophen. Phenacetin was the first drug used in this group, but due to its severe effects, it was withdrawn. So phenacetin सबसे पहला ड्रग था जो यूज किया था ऑफ दिस ग्रुप, बट उसके सीवियर इफेक्ट्स के वजह से इट वाज बैंड. So they created another metabolite of phenacetin called as paracetamol, and was found to be safer and effective. So उन लोगों ने क्या किया, और एक phenacetin का और एक मेटाबोलाइट क्रिएट किया which was called as paracetamol, which was safer and effective than the phenacetin. So next is actions, pharmacological actions. So paracetamol has analgesic, good antipyretic, and weak anti-inflammatory properties. So, as you all know, it is an NSAID. So, analgesic and antipyretic and anti-inflammatory properties are most common seen in this kind of drugs. So, here why it has a weak anti-inflammatory property, you must be wondering. So, here we will see the answer for it. The inflammatory sites are rich in peroxides generated by the leukocytes. So, in presence of peroxides, paracetamol is a weak inhibitor of COX and thereby inhibit the PG synthesis. So, जो inflammatory sites है वो क्या है, peroxide से भरे हुए हैं. पेरोक्साइड किससे जनरेट होता है, ल्यूकोसाइड पेरोक्साइड को जनरेट करता है. सो वो इन्फ्लामेटरी साइट्स पेरोक्साइड से ज्यादा भरे हुए हैं. सो इन प्रेजेंस ऑफ peroxide, paracetamol will inhibit cyclooxygenase, but there will be lesser effect of the paracetamol due to the peroxides. Okay, due to peroxides there is a decreased activity of paracetamol on the COX, and hence if there is decrease in the COX inhibition, then automatically there will be decrease in the PG synthesis. Okay, so there will be decrease in the PG synthesis. Hence paracetamol has the poor anti-inflammatory action. So paracetamol is active on cyclooxygenase in brain, which account for its antipyretic action. So paracetamol active है cyclooxygenase पे, which is present in the brain, and hence give an antipyretic action. In presence of peroxides which are present on the inflammatory sites, paracetamol has the poor ability to inhibit the cyclooxygenase. As I have already explained you all, due to presence of peroxides which are present on the inflammatory sites, paracetamol will have the poor ability to inhibit the cyclooxygenase due to which, due to peroxides. Okay, due to peroxides it has a decreased activity to inhibit the cyclooxygenase. So this is about it. It does not stimulate respiration, so it has no activity on the respiration, no action on the acid-base balance, no action on cellular metabolism as well as cardiovascular system and platelet function. And also it is not an uricosuric agent. It have an only mild gastric irritation. It may give an irritation, but that too most mild. So next is pharmacokinetic. Paracetamol is well absorbed orally. That's why it is taken orally. It can be well absorbed orally, and 30% it is protein bound. So it will bound to protein only. Out of 100%, it will 30% it will bound to protein, and hence it will be get metabolized. So it will metabolize by the hepatic microsomal enzymes. Okay, so what are these hepatic microsomal enzymes? These are the enzymes which helps in metabolism in the liver. They are present in liver, and this metabolism can happen by different reaction. First is by gluconoride conjugation, and glutathione conjugation. Okay, glutathione conjugation. So these are the two reactions by which it will convert and get metabolized. So now it is available in two forms, that is crocin and dolo. So crocin may contain 50 mg and 650 mg tablet, as well as dolo maybe you have 50 mg and 650 mg tablet. Next is mechanism of action. A small portion of paracetamol is metabolized to a highly reactive intermediate. So first step is when the paracetamol is administered in the body, so it will converted into a highly reactive intermediate. It is an intermediate, so paracetamol will convert it into an intermediate in the liver. So what is that intermediate? That is N-acetyl benzoquinone imine. So this is the intermediate form of the paracetamol. Then we will see what is the next step, which is then detoxified generally by conjugation with glutathione. As you have already seen, the metabolism takes place in liver, and by which reaction? Glutathione conjugation with glucuronide or glutathione. So this N-acetyl benzoquinone imine will get detoxified by conjugation with glutathione. So this is the general mechanism of action. So now we will see, when we will take a larger dose of paracetamol, what will be this reaction. So however, when a larger dose of the paracetamol are taken, hepatic glutathione is depleted and the toxic metabolite binds to sulfhydryl group in hepatic proteins, resulting in hepatic necrosis. So when we will take a larger dose of paracetamol, glutathione is depleted. Okay, depleted, hepatic glutathione डेप्लीट हो जाता है, एंड टॉक्सिक मेटाबोलाइट्स जो है वो किससे बाइंड करते हैं? सल्फाइड्राइल ग्रुप से in the hepatic protein, and which will leads to hepatic necrosis. That's why it can cause hepatotoxicity. Okay, so see here, now we will see how toxicity occurs in the liver. So first, the paracetamol is metabolized in liver, get converted into toxic metabolite, that is N-acetyl benzoquinone imine, which will then binds to sulfhydryl group in the liver proteins, and which occurs hepatic necrosis. Okay, so here is a normal metabolism. Paracetamol in presence of cytochrome P450 in with sulfate conjugation and glucuronide conjugation get transformed into a non-toxic metabolite, whereas this also here non-toxic metabolite with the glutathione conjugation get converted into a non-toxic metabolite. At the higher dose of the paracetamol, it get converted into a toxic metabolite, and here then N-acetyl parabenzoquinone imine also uh, get converted into a toxic metabolite and binds to a sulfhydryl group in the liver, and hence hepatic necrosis occurs. Here antidote for the paracetamol used is N-acetylcysteine. Okay, so now we will see adverse effects. In paratic doses, paracetamol is safe and well tolerated. So at the antipyretic doses, means at lower dose or at 500 mg or 650 mg, paracetamol is safe and is well tolerated. Nausea and rashes may occur. This is the common adverse effects you can write. At larger dose, acute paracetamol poisoning. So here we have seen we will get paracetamol poisoning also at higher dose. Okay, not at lower dose. Paracetamol is a hepatotoxic Paracetamol is a hepatotoxic and can cause severe hepatic damage. So it is a hepatotoxic, as you have saw in the diagram, and can cause hepatic damage. Manifestations are seen in 2 to 4 days. So there will be manifestations. Continuous higher doses use of paracetamol can cause hepatic damage, and hence the manifestations can be seen in 2 to 4 days. So jaundice, liver tenderness, these are the adverse effects. Hepatic lesions are reversible, can be treated. Okay, hepatic lesions can occur, and also they are reversible. Nephrotoxicity may result in acute renal failure. So there can be the chances of nephrotoxicity. So now uses as you all know, paracetamol can be used as an analgesic in painful conditions like toothache, headache, and myalgia. Myalgia is nothing but muscle pain, and as an antipyretic, that is in fever conditions we can use it. So about paracetamol, there can be question for 5 marks. You have to include in that, you have to include mechanism of action, sorry, pharmacological actions. This much is enough for 5 marks. Next is pharmacokinetics. Now if you remember, you can also write the doses in pharmacokinetics. Next is mechanism in the form of flow chart will be more attractive, so you can prefer writing in this form. It, it it is also easier to understand it like this also, so you can prefer to write like this. So this is not this is for your understanding, this is not compulsory to write in the exam. And adverse reaction and uses you have to include in 10 marks also, and also in 5 marks. So next we will see propanoic acid derivatives. In that we will see ibuprofen. So ibuprofen is a better tolerated than aspirin. So ibuprofen is of lower um, action than the aspirin. Analgesic, antipyretic, and anti-inflammatory efficacy is slightly lower than aspirin. So here it can act as an analgesic, antipyretic, as well as anti-inflammatory. So here the efficacy of this drug is efficacy means effect. Efficacy is nothing but effect. So effect is lower than the aspirin. So it is hence well tolerated. So we can use this instead of aspirin. So it is 99% bound to plasma proteins, ibuprofen and other hence their action or efficacy is lower because they are bound to plasma proteins. Ibuprofen and other propanoic acid derivatives are well absorbed, more than 90% bound to plasma protein, cross the blood-brain barrier, also reach the synovial fluid. So this you can include in this sentence you can include in pharmacokinetics, that is ibuprofen and other are well absorbed, and more than 90% of it are bound to plasma proteins, and hence can cross the blood-brain barrier, and also reaches the synovial fluid. They are metabolized in liver and excreted both in bile and through kidneys. So they can be they are metabolized in liver also, liver, and are excreted through bile also and through kidneys also. Ibuprofen is available for oral, parenteral, and topical use. In topical use, there are some gels and creams. So most of the available form is orally only. Okay, here we use more. We prefer tablet only. Okay, so doses are 400 to 800 mg. Brufen is 200 mg, 400 mg, and 600 mg. These are some other examples of ibuprofen. So now we will see adverse effect. So these are mild compared to other NSAIDs. Okay, and the incident of the effect is lower than the compared to other drugs of this NSAID class. So nausea, vomiting, gastric discomfort can also occur when this is administered. CNS, it can affect the CNS activity. It can cause hypersensitivity reactions. There may be fluid retention in the body. So uses are, it can be used as an analgesic in painful conditions, as it is more commonly prescribed, but are less common than aspirin and paracetamol. In fever, soft tissues injuries, fractures following tooth extraction, to relieve post-operative pain, dysmenorrhea, and osteoarthritis. This can be used in these all conditions, okay, and also in gout. So thank you. This was it for this video. For next, comment down what all drugs of this class you want me to explain. So these were the main drugs, that is aspirin, ibuprofen, and paracetamol. Rather, these are the 5 marks questions. So I have covered these drugs. If you want me to cover any other, then please comment down in the comment section. Thank you.